All right, it looks like we are ready to get started. I hope everyone can hear me okay. Thank you for joining us today for our Technical Assistance webinar. So this webinar is to help anyone understand any questions they might have about the application process. And hopefully, if you have any questions, you can ask us directly. All the questions that will be asked will be posted publicly on the website. So we will get started. So here's our webinar agenda. We're going to go over all of the components of the application. Of course, it's not going to be in as much detail as the application itself, so make sure you still read the application cover to cover. To submit questions during our presentation, if you're unfamiliar with using the GoToWebinar program, go to your control panel on the right side of your screen. You'll see the question box there, and you're able to type in questions and submit them that way. If you do not see your question box, go to the View portion at the top of your control panel. When you click View, you should be able to choose the Questions tab. When that question mark is checked, then hopefully that question box will appear so that you can type in questions. And we'll have a couple of portions throughout the webinar where you can type in questions and ask them. You can type them in whenever you would like during the webinar, and when we get to those question portions, I'll have Brad read the questions out. And then we have a couple other folks on the line who will be able to hopefully answer all of your questions. So the purpose of these grants, we just released our new 2016 to 2020 Utah Comprehensive Cancer Prevention and Control Plan. So these projects are to address one of the 4 priority areas in the new plan. And those priority areas are physical activity and nutrition, skin cancer, cancer screening, survivorship, and quality of life. And these projects have the end goal of leading to lasting and impactful change, either within an organization or a community. As a brief summary of the grant, all the applications are due by 5 p.m. on March 28th of this year, 2016. Applications submitted after 5 p.m. will not be considered for funding. Incomplete applications will also not be considered for funding. Now, these projects are to occur between July 1st of 2016 and June 30th of 2017. That's also when the funds will be available. Excuse me, we are planning to give out 3 to 6 awards of $15,000 to $20,000 each. To be eligible for these grants, you need to be a Utah-based organization in good standing based on the following: resolution of any state of Utah audit exceptions, resolution of judgments against the applicant by the state of Utah, and fulfillment of all previous grant obligations by the applicant with the state of Utah. These grants run on a cost reimbursement process. So cost reimbursement means that the grantee will be paid for activities performed as defined in the grant. So they're usually divided up into 4 installments, 1 per quarter of the fiscal year, and the payment is dependent on achieving goals outlined in the grant. So if you are awarded the grant, you will invoice the Utah Cancer Control Program outlining the activities that you've completed, and then we will reimburse you for those activities. But if some of the funding is needed up front, just specify that with the budget information in your application, and there are exceptions that are allowed for that. So there are funding restrictions that the grant money can be used for. The grant money cannot be used for advocating or lobbying elected officials, grassroots lobbying, which means you or your organization asking someone else to contact their elected officials, any construction, but do note that funding for equipment or infrastructure will be considered if it contributes to your proposed public policy change, organizational policy change, or change in the community environment. Funding cannot be used for any space, phone, etc., anything like that. Food, direct clinical services, any general operating expenses for your organization, or research. To submit the application, you need to email your application to Brad Belknap at bradbelknap@utah.gov by 5 p.m. on March 28, 2016. Make sure you put UCCP grant application in the subject line and that you attach your application in a PDF format to your email. Late applications will not be considered for funding, so just keep that in mind. If the email comes in after 5 p.m. on March 28th, it will not be considered. All applicants will receive a confirmation via email once their application is received, just so you know that we received it. So just briefly, this is the checklist of required items. This is also something you'll see in the application. We need to make sure we have your agency background, description of your proposed project, description of the need for your project, description of relevant partners, letter of support from each of the relevant partners, your action plan, evaluation plan, plan for sustainability, budget, and in-kind contributions. And just keep in mind that if any of these items is not included, your application will be disqualified. So the scope of work, your application should address one of the following 4 components. These are the components we described above to address our priorities of the cancer plan. Component 1 is physical activity or nutrition. Component 2 is skin cancer prevention. Component 3 is reducing barriers to cancer screening. And component 4 is cancer survivorship and quality of life. Projects should plan or implement changes either in public policy, organizational policy, or by changes to the community environment. So component 1, physical activity or nutrition. You can either address the availability and consumption of fresh fruits and vegetables or the availability and use of resources for increased physical activity. Projects in this area will work to increase the availability and consumption of fresh fruits and vegetables in a school district, large worksite, or target population. So these should plan for or expand public policies, organizational policies, or changes to the community environment within a target population, so a population that you deem that has a need in this area, or a geographic location such as a local health district, county, city, town, school district, or census-designated small area. Target populations or locations must have a demonstrated need based on at least one of the following: availability of healthy food resources, fruit and vegetable consumption rates, low socioeconomic status. And examples of some of the projects that will increase the availability and consumption of fresh fruits and vegetables that might give you some ideas. One is develop or expand community gardens and farmers markets in the community. Another one is provide only healthy, appealing, and affordable food options in cafeterias on school campuses. Establish an employee garden at a workplace. Facilitate farm-to-plate agreements between local food producers and community organizations, including schools, worksites, and hospitals. And it's not limited to just these examples. These are some examples that we've come up with or seen in the past. So other evidence-based approaches may also be used. And keep in mind that we are looking for large, impactful, sustainable change. So we may be giving priority to projects that address large work sites or large organizations or large school systems. So for availability and use of resources for increased physical activity, projects will plan for or expand public policies, organizational policies, or changes to the community environment within a target population or the same geographic location such as local health district, community, city, town, school district, or census-designated small area. The target populations or locations must have a demonstrated need based on at least one of the following: availability of physical activity resources or physical activity rates. Also, low socioeconomic status. Examples of some of the projects that fall in this category are developing a plan to create new safe routes or improve safety of existing routes for cyclists and pedestrians to travel. Establish joint use agreements with local school districts to allow community members to use school facilities for physical activity, or establish policies and create facilities to allow employees to exercise during the workday. And once again, other evidence-based approaches may be proposed as well. Are there any questions for the first component, the physical activity or nutrition section? I'll wait just a few seconds and see if someone has a moment to type their question.
We do have one question so far that is more general about the application. Do you want to take that now, Kendra, or should we wait till the end?
Let's wait to the end and see if it gets answered.
Okay.
Any other physical activity nutrition questions?
Looks like there's no additional questions.
Okay, so we will continue then. Oops, just to remind everyone how to submit the questions. Looks like we're not having a problem with that. So moving on to component 2, skin cancer prevention. So these projects should promote public policies, organizational policies, or changes to the community environment that advance the national goal of preventing skin cancer. They should implement one of the 3 strategies promoted under Goal 3 in the Surgeon General's Call to Action to Prevent Skin Cancer, and these include support the inclusion of sun protection in schools, planning and development of school facilities and school curricula, incorporate sun safety into workplace policies and safety trainings, and support shade planning in land use development. The projects for this area should reach a large number of people, so consider working with a large school or work site or several small or medium schools or work sites. And if you do decide to work with a school district, that is considered a large school system. Any questions about skin cancer prevention? Wait just a few more seconds.
Doesn't look like we have any questions specific to skin cancer. Just a reminder, more general questions we will answer at the end.
Okay, I'm going to continue. Component 3 is reducing barriers to cancer screenings. So within this category, we have 2 components: decreasing barriers to cancer screenings among employees at work sites by changing worksite policies, and component 3.2, increasing awareness, education, coordination, and reducing barriers in healthcare settings by changing organizational policies. So the first one, changing policies at work sites. The project should develop or implement a plan to make changes to worksite policies that address barriers to cancer screening. And they can work with management. Example, it would be an HR director at a worksite or worksites to decrease barriers to cancer screenings among employees. Projects should try to reach the largest population possible. They should seek to start programs at worksites that do not have worksite wellness programs or improve upon existing programs. Examples of projects in worksite policy changes that will reduce the barriers to cancer screenings are allowing flexible work schedules or leave time during the workday for employees to get screened, allow mobile facilities like the mobile mammography units to come to the work site and allow employees to get screened on work time, develop a reminder system to send reminder cards or virtual reminders to employees who are due or overdue for cancer screenings. So the next section, for reducing cancer screening barriers in a healthcare setting. These projects would implement organizational policies to improve screening processes and decrease barriers to cancer screening within a clinic or hospital setting. And they should aim to work with at least one clinic or hospital. Examples for this category are creating a pilot program that models evidence-based strategies for successful quality improvement in clinics or hospitals, establishing patient navigation programs to help patients throughout the screening process, creating a pilot program that models the creation of a medical home for all patients, establish office policies which support screening, such as a reminder system, and measure progress regularly, increase the use of health information technology for cancer screening tracking. Are there any questions specifically for the cancer screening section?
Looks like we don't have any questions specific to the cancer screening section at this time.
Okay. I'm going to continue on to component 4, cancer survivorship and quality of life. Projects in this area should aim to develop a cancer survivorship navigation program, although it's not expected that the program will be implemented during the funding period. So patient navigation is defined as individualized assistance offered to patients, families, and caregivers to help overcome healthcare system barriers and facilitate timely access to quality medical and psychosocial care. So cancer survivorship patient navigators may assist cancer survivors through all stages of their cancer journey, from diagnosis through treatment and transitioning into life after cancer. So some of these examples of what the patient navigation program should include for your project is assessing the need for implementation of a patient navigation program, enlisting support from departments or organizations involved in the care of patients, develop program materials, for example, documents, posters, brochures, policies or procedures, anything like that, outreach strategies that may help in the creation of the navigation program. Those applying for funding under this component should utilize the following resources to develop their application proposal. Since patient navigation is a relatively new area, there are some other states who have done some great things in this field, and so we have quite a few toolkits and resources available to help you develop your application for a patient navigation program if you choose to apply for this component. Any questions about the patient navigation survivorship quality of life component?
Looks like we still don't have any additional questions.
Great. We will continue on. So more into the technical side of the grant application, the contract requirements. We do have some data reporting and entry requirements. We require monthly conference calls with our Utah Cancer Control Program staff, 2 written reports, a mid-year and a final year report, and we have those submitted through our Catalyst reporting system, which is a web-based online reporting system. And we do allow subcontracting if it's approved, if you need any of that done for part of your project. There is a possibility of project renewal. Additional funding may be available for up to 2 additional years, and that additional funding will be awarded at the discretion of the Department of Health. So just keep in mind the checklist of the required items. We're now going to go through each of these sections in a little bit more detail. The application content consists of 2 sections, agency qualifications and project proposals. For agency qualifications, you need half a page of the agency background. You need to demonstrate experience with carrying out sustainable and impactful projects, also half a page. Make sure to submit a resume or CV for staff overseeing the project progress. You also need to demonstrate experience with evaluation and make sure you submit a resume or CV for the staff for evaluation as well. Project proposal content, a description of the proposed project, about 1 page, a description of the need, and that's the need for the population for your project, half a page, description of relevant partners, the action plan, Appendix A in the action plan, evaluation plan. All of the appendices can be downloaded. We have templates for those that can be downloaded at our website. You also need to include the letters of support, the conflict of interest disclosure, and the plan for sustainability. For the evaluation plan, it at a minimum should include how you will determine to what degree the project was implemented as planned. This is called the process evaluation. Projects should also include to what degree project objectives were met. This is called the outcome evaluation. And if you include both of these, it will be stronger for your candidacy to get funding. The plan should cover the purpose, the evaluation questions, the methods, and how and when findings will be shared, as well as who they will be shared with. Evaluation data collection, this is for the methods section of your evaluation plan. Types of data collection include surveys, secondary data sources like BRFSS or cancer registries, focus groups, key informant interviews, etc. Evaluation indicators should be present. These are the variables or data points that would be used in the evaluation. Examples include self-reported BMI, number of minutes exercised, self-reported participation of program, etc. More of the methods for evaluation plan. Evaluation participants. This should involve both information about the participants who will be involved in the evaluation as well as the number of expected participants. The more specific, the better. Evaluation analysis should involve, at the very least, some form of descriptive statistics like average age, percentage of participants who completed an intervention. The analysis should be appropriate for the type of evaluation conducted. For example, a process evaluation does not normally include regression coefficients. Are there any questions regarding any of the evaluation or content?
Doesn't look like we have any questions specific to the evaluation. So we have received some questions, additional questions, more general, or questions that we can address at the end, but nothing specific to evaluation.
Okay. Great, we'll continue. Evaluation criteria. So this is how your proposed project application will be scored. So they will be evaluated against the following criteria: your overall project, project action plan, clarity of project objectives and activities in the action plan, project partners, project evaluation, project budget and justification, project sustainability, project impact, and the link to the state cancer plan. And this is an example of what the score sheet will look like. This is a little cross-section of one of the pages of the score sheet, so you can see how those would be scored for the overall project, project action plan. And they all have different point values, so make sure you pay attention to that as well. Tips for writing the application. Make sure you read the request for grant applications packet from cover to cover. There are key points of information throughout that whole packet. So this presentation only highlights particular pieces of the packet but is not comprehensive, so make sure you read through that thing. And also be sure to address each of the items in the request for grant applications. Complete the checklist. We really want to highlight the checklist a couple times in the presentation just so you don't accidentally forget something that's required. Also use the provided templates. You can download all of the editable versions of the templates that you saw as the appendices at our website that's listed there. So if you happen to have any questions after we have our webinar today, you're welcome to email any additional questions to Brad Belknap at his email address there on the screen. And questions and responses will be posted and made available to the public at our website within 2 business days of being received. So if you do happen to have more questions after our webinar, you're welcome to email those to Brad and we will make those available to you. And we are recording this webinar and we will be posting that recording on our website as well. So if you want to reference it later, that's where you can do that. Okay, I believe we've come close to the end, so let's answer all of those questions. Brad?
Okay. So the first question we received states, we aren't clear what the best and final offer means. Could you address that here? I can address that. So this is referring to the best and final offer clause that we have in the application packet. And what this means is that the issuing agency, meaning the Cancer Control Program who's issuing the funds as part of these grants, reserves the right to notify any applicant that we would like a updated budget that reflects the best and final offer based on any negotiations we've done. So for example, if an applicant were to submit an application, it were to go through the process of being reviewed, and we decided that before we could accept the application, we needed to make some changes. So if there was something in the application that was either not allowable or something that would need to be taken out in order for it to be approved, the Cancer Control Program reserves the right to go back to the applicant and say, here are some issues that we have with your application. We would like you to make those changes and then submit back to us a best and final offer of what you think it would require to do the project with these new changes. So it's a way for us to kind of allow some negotiation as part of the process rather than an all or nothing in case someone missed something during their application process, or in case you have a good project but there was something included that shouldn't have been included. So we have done that in the past. We have issued best and final offer requests, and all that means is that we would require an updated budget that reflected what it would take to accomplish the project as it stands after we've negotiated those terms. So the next question we have is about the physical activity components. So it states, does active transportation fit into the physical activity component where it talks about developing a plan to create new safe routes or improve the safety of existing routes for cyclists and pedestrians to travel?
Do you want to answer that, Brad, or do you want me to pass it on?
We can pass it on, whoever would like to answer that.
I can answer that if you want. Yes, absolutely. So with the condition of active transportation plans, we want to make sure, you probably noticed in the funding restrictions, that we cannot fund construction or materials cost. So we love to fund projects around active transportation that have to do with planning, the design, and getting partners and resources together to carry out an active transportation plan for a community. However, we cannot fund things like pavement or signage or any of the actual construction that goes into laying down all of the new active transportation infrastructure. So we do love seeing projects like that, but just keep that in mind that what we can fund is limited regarding more of the planning, staff time, things like that that go into the project, and we cannot fund the construction aspect of the project. Brad, is there anything else you want to add to that?
No, I think that that's adequate. I mean, I think just emphasizing that the purpose of these grants as a whole is really to try to build sustainable changes, and that means working to actually plan and develop the program in such a way that it can exist and be self-sustainable, including what you were talking about with the active transportation programs. That we love working on active transportation type programs, but we want to make sure that we are helping to fund projects that can be sustainable over a long period of time, rather than just paying for a one-time building or maintaining a particular aspect of active transportation plans. So those are all of the questions we've received at this point. I just want to remind all of the attendees on the webinar that if you have any other questions, please submit them now. This is actually a fairly unique opportunity, and it's an advantage that attendees have to have the issuing agency basically their time and attention dedicated to answering any questions you may have about this opportunity. So if there's any other questions you have, we would be more than happy to take them now. So we can wait just a minute or two to see if anyone has any additional questions that they would like to request. And again, if there's anything that you'd like to know, even if it's small, please ask it, and we'd love to talk about it. So we did receive one more question. The question is, will the funds be tracked through the local health department and state MER? So the funds for these grants will require that a contract be in place with the state of Utah Department of Health. So all awardees will be required to go through that contracting process. For local health departments, the funds would be available through the standard state contracting process specific to local health departments, and would be able to be monitored by the local health departments in a similar way that they monitor other funds that come from the state. For community organizations or other organizations that don't have access to that system, would be able to monitor that through the contracting process and request updates through the contracting process. We can wait a few more minutes in case there's any additional questions that people have. Like I said, we would love to take any questions that people have regarding anything about this grant opportunity. So if there are any additional questions, please let us know. We'll wait a few more minutes. So it looks like we just got a new question. The question is, does this grant cover employee time or wages? We understand that it can't be for managerial salaries. Kendra, do you want to either pass that on or address that?
Brad, you can probably correct me if I'm wrong. So yes, we can pay for staff time that's devoted to the project, but yes, not anyone's salary should be totally dependent on this project, but we are allowed to pay for staff time. We understand that it does take a lot of time to plan and implement these projects, so that is something that's allowable. Is there anything else you wanted to add?
No, I think that covers it. The purpose of that limitation for managerial salaries is because these funds are restricted in that they cannot pay for any organizational indirect costs or overhead costs that are just costs associated with running an organization in general. These funds are meant to be earmarked or dedicated specifically for this project. So if there are any staff that are required to dedicate their time and would need to be paid out of these funds, that's fine, as long as those staff are dedicating their time to the project. But the funds cannot go to pay just a manager or executive of the organization simply because these funds are going to that organization. We can wait a few more minutes to see if there's any additional questions. These have been great questions, by the way. We appreciate that. So it doesn't look like we have any new questions. Are there any last-minute questions people would like to ask? Again, this is a great opportunity to ask anything that you may be wondering about the application process or about potential issues or questions with projects, anything at all. This is a great time to ask it. So if there's any additional questions, we'll take them. So it doesn't look like we have any additional questions. So I'll hand it back to you, Kendra.
All right. Well, thank you, everyone, for joining us. I hope that you've got some good information out of our webinar today. And just keep in mind that if you do have any
Kendra,
additional...
sorry.
Yes.
There is one question that's currently in progress before we wrap it up.
Well, we'll be glad to wait then. We're even early.
You can finish your thought, but we won't actually end until we get all the questions.
Oh, okay. So all I was saying is that if you do have any other questions after we've ended the webinar, make sure to email those to Brad, and we will post those questions and answers publicly on the website. And these webinars are being recorded, and we should have the recording of the webinar on the website for you to access. Usually by the end of today is a doable amount of time, and then you can reference those throughout your application writing process.
So the question that came through is, can we propose some of our projects before we submit the final proposal? I think I'll answer that since questions come through me. So I would say yes, sure. I mean, you can ask, and you can ask if a particular project proposal is something that would fit the scope of work of the application. I will say, however, that a few things. One is that, to be fair to everyone who may be applying for this, we can't actually tell someone that their project is a good project that we would fund or not. So the more general the question that you have, tend to have a more general answer. But I'm more than happy to talk through any project proposals and to help you to understand whether or not that type of a project would be a project that would fit the scope of work. So if you have any project ideas that you'd like to talk about, you're more than welcome to submit those, and we can discuss them while we have everyone on the phone, or you can always email me project proposals to my email address that was in the webinar as well. So are there any additional questions or comments that people have? If there are, please submit them now. Otherwise, we can wrap up this webinar. We can wait a few more minutes. Doesn't look like we're getting any more questions, Kendra, so I'll again hand it back to you.
All right, thank you, and thanks again everyone for your questions. I'm sure they will be useful to other people applying for the grant as well. So once again, just keep in mind the recording of this webinar will be available on the website by the end of today or tomorrow morning, and you can access that if you need to reference anything we covered again today. We will also be accepting questions and answers. If you email them to Brad after our webinar is over, he will post the questions and answers publicly on the website as well. So we'll go ahead and end the webinar. Thank you for joining us, and we hope to see your applications come through. Thank you.